Massachusetts has a new weapon in the ongoing fight against opioid abuse. Yesterday morning, the state activated the online Massachusetts Prescription Awareness Tool, or MassPat for short. The premise is pretty simple. By sharing information about which of their patients are being prescribed painkillers, doctors can play a key role in preventing overprescription and addiction. Participation is voluntary for now, but Mary Lou Sutters, the state secretary of Health and Human Services, says physician interest is already high.
We're particularly focused on the individuals who have prescribed within the last 6 months an opioid. And so 63% of prescribers who have prescribed an opioid in the last 6 months are now on the PMP. We've seen an uptick every day.
That sounds like good news. Now, for more on how this program can make a dent in the opioid epidemic is the state's public health commissioner, Dr. Monica Burrell, and Dr. James Gessner, president of the Mass Medical Society. Thank you both for being here. So I just described participation as voluntary, but that's not entirely accurate. How are you guys getting doctors to take part in this? And is there going to come a point where they will simply have to?
Sure. So all prescribers, through their Massachusetts Controlled Substance Registration, must then also sign up for the prescription monitoring program. And right now, if any prescriber is prescribing an opioid for the first time, they have to check the prescription monitoring system. And starting October 15th, anytime an opioid is prescribed, the prescription monitoring system must be checked.
So it's sort of a soft launch, but pretty soon everyone who's prescribing this stuff is going to have to use the tool.
Absolutely.
Okay. Before I get to you, Dr. Gessner, well, actually, let me ask this of both of you. To what extent is the opioid epidemic, as a phrase we always use, how much is it driven by overprescription of painkillers by physicians? It's a big question, I know. But
well, you know, this current opioid epidemic, really one of the really important contributing factors is opioids that are received as a prescription. And whether it's the individual's prescription or something that they receive from a family member or a friend, it oftentimes is the starting point for when an individual becomes then to suffer from substance use disorder. So that's why, as we think about how to respond to this, we look so strongly at prevention so that individuals understand the potential risk of taking opioids.
Would you agree with that assessment?
I would agree. Appropriate prescribing, safe storage, appropriate disposal. Critical in the whole loop of opioid therapy.
Since we already had a prescription management plan in place in the state, what is better about this? You know, and it may be difficult for non-physicians to understand, but how is this an improvement on what we had under, for example, Governor Patrick?
So our old system, which by the way we were one of the first states to adopt, and it really provided useful clinical information. So in my previous work as a clinician, I used it all the time. It was a powerful clinical tool that gave information that helped with clinical decision making. However, it was 11 clicks and it took many minutes to use. The new system is fast, it's accessible, it's within seconds that you get the information you need, and it's interoperable with electronic medical records, and importantly, you could look at the states around us.
Is the information that it gave you, or that the old system gave you, was it the same kind of thing? I have a patient coming in tomorrow, I want to see what prescriptions he may have received for painkillers in the last year or so, but it was just harder to get that information?
That's right.
Okay. I got to ask you what your members think about this, because this is another type of oversight. I know that a lot of physicians feel like maybe they already get too much oversight. Do they think this is a good idea, or are any of them balking at this?
I think you'll find very few people balking. We're thrilled with this system. Thrilled literally. This system is fast, it's efficient. The old one was clunky, was hard to use. The data here is updated in real time. Physicians and prescribers can delegate other people in the office to prepare lists for checking so that it doesn't detract from clinical face time. Everything about this system is good, and it answers many of the questions that we had been concerned about over the years, and we're very pleased. And we'll find our physicians using it, and pleased to do so.
Just to take a step back, how do some people who are struggling with addiction, how do they game the system when it comes to going around to different physicians or different pharmacists or different medical specialists in different states and stocking up on medication? What do they do?
Well, you know, substance use disorder is a tricky illness, so it is a medical disease, but it affects the brain, so it affects the way people behave and act. And it's possible that you could do what's called doctor shopping and go to multiple different doctors, and pain is so subjective that as the doctor, you may not know that they've gotten a prescription from, say, Rhode Island or Vermont. So now, when you look at the prescription monitoring system, and you're the patient sitting in front of me, I could see that you've had prescriptions from Vermont and Rhode Island, for example. So it's a way to put all those pieces pieces together, and it's really meant to be a tool to be helpful. So now it's an approach to a patient where you screen them for this disease and try and help them and get them to treatment.
I know you were asked in the rollout yesterday about whether the state is going to look at people who are prescribing large amounts of this via the system, find physicians who are maybe overprescribing and take some sort of step to sanction them. What is the plan there? Because I'm still unclear on it.
So the prescription monitoring system has two purposes. At the micro level, it allows the individual clinician to look at individual patients and for us in the background to see what individuals are doing. At the macro level, we have all this aggregate information that shows us what's happening across Massachusetts. At the Department of Public Health in general, I'm trying to get us to use data more to make our decisions so we can connect that information to the other information we have about overdoses, look for patterns, and try to together find the solutions to this epidemic.
Dr. Gessner, if one of your physicians gets a letter, say 5 years down the road, saying, we've noticed that you're prescribing a little too much when it comes to painkillers, we'd like, and this is hypothetical, we'd like you to ratchet it back, you think that they might bristle at that?
I think that physicians want to take care of patients. They want to take care of them appropriately. And our approach has been that this prescription monitoring tool is probably the best adjunct that we have to find appropriate use and potential misuse for prescription medications. And our message to physicians is that if physicians are following the guidelines that we have promulgated and the Board of Registration of Medicine has agreed with, and the patients are being taken care of by the physicians in an appropriate way, the physicians have nothing to be concerned about in the care of acute or chronic pain.
All right, Dr. Gessner, Dr. Burrell, thank you both.